So now you've done the imaging, suppose you actually find a neurosurgical problem. What are the things that you see? Well, we talked a little bit about the types of things that are causes of headache. Again, neurosurgical findings in general are very rare. This is a list of some of the different ones. I really want to emphasize the last three, hemorrhage, Chiari, and hydrocephalus, because they tend to be the ones that we see the most commonly when something is found. Hemorrhage really is a five-alarm fire many times. It can be seen after trauma. It can be seen as the consequence of a vascular lesion. It can be seen in a bleeding tumor, or it can be part of an underlying medical condition like coagulopathy or mycotic aneurysms. So why is hemorrhaging a cause of headache? It can cause pressure on the surrounding tissue, or it can cause chemical irritation of the meninges. The main hemorrhages we see are epidurals, EDH, which are often associated with trauma or skull fracture, subdural hematomas, which may be associated with child abuse or trauma, interparenchymal hemorrhage, which we'll talk about as a concern for vascular lesions or tumors, and then subarachnoid hemorrhage, which is very rare in kids outside the setting of trauma. Just going through these briefly, epidural headache, this is the classic med school textbook. I have a headache, and then zzz, the kid passes out. An epidural hematoma is very commonly associated with a skull fracture, up to 90% in many cases, and usually is associated with a laceration of a meningeal artery. The blood collects between the hard skull and the dura, and although it's commonly frontal or temporal, it really can present anywhere. These are really dangerous because the kid may be stunned from the initial injury, but then look fine and have a lucid period for minutes to hours, and then get incredibly ill. And this is a surgical emergency. This imaging shows the fracture of a skull. You can see the blue circle around it, and in the picture on the left, you can see the swelling in the lower left side of the image down in the 7 or 8 o'clock region. That fractures a blood vessel, and you can see the massive blood clot, the big white crescent here. It's pushing the brain over. Within the blood, you see gray and white areas indicating active ongoing bleeding. This is really a fatal and five-alarm fire emergency, but thankfully with surgery, if removed in a timely fashion, the kids can be totally normal and do great afterwards. So having that known history and exam can really pinpoint this and get urgent imaging. Subdural hematoma, the so-called fussy baby headache. This is usually caused by tearing of veins on the surface of the brain. The hemorrhage can be at the dura-arachnoid interface, and unfortunately there's a very high association with trauma, and one has to think about abuse in the absence of other known trauma like a fall or a car accident. This is an example of a subdural hematoma. In the left picture you see over the crescent of the brain, sort of from the 9 o'clock to 3 o'clock rainbow on the top, you see several different layers of white and light gray. These are the subdural hematomas from those veins there. After treatment, you see they go away on the right, but these are certainly pathognomonic of a subdural hematoma on CAT scan. This is what it looks like on gross pathology. You have this layer of blood. This tends to be more associated with an acute trauma like a car accident, but certainly something to think about and important to identify in imaging. The worst headache of my life are the scary lesions for vascular disease. This is the subarachnoid or interparenchymal hemorrhages. These massive subarachnoids are often associated with either laceration of large arteries, like a vertebral artery imaging, after trauma or after aneurysms. Aneurysms are very, very rare in kids and probably less likely than one might think. However, the sudden onset of a spontaneous headache should make one think of a vascular etiology, and in kids, an arteriovenous malformation really is a much more common finding than an aneurysm. AVMs are abnormal connections of the arterial system to the venous system with no capillary bed, and the headaches in acute stages can be from hemorrhage, but in a chronic stage can be from ischemia or vascular congestion. This is what a subarachnoid hemorrhage looks like. You see on a CAT scan here all the white signal in the sulci. The blood basically leaks out and around the brain. This is in contrast to an interparenchymal hemorrhage. This is an MRI showing an AVM in the upper right part of the picture, which is the left frontal part of the brain in a child, you can see the dark squiggles there, and the arteriogram on the right shows this tangle of abnormal blood vessels. These are very common causes of vascular hemorrhage in kids, and it's worth reviewing AVMs certainly as a cause for this if suspected. Some of the take-home messages, I think, for hemorrhage-related headaches, the acute onset of a sudden unexpected headache should make you think of vascular in the absence of trauma. It can really be an emergency. Epidural hemorrhages after trauma are a surgical emergency. Subdural hematomas should make you think about abuse or trauma or associated injuries. And then an intraparenchymal subarachnoid hemorrhage really should make you think about a surgical emergency. Call for consultation early. We'll have some contact information at the conclusion of this discussion, but really if there's any question, this is something that should not delay.